Well said. On now to what's new in medicine today. A local woman says a newer therapy to help with intimacy has made a big difference in her life. It is a treatment that uses what's called PRP, or Platelet Rich Plasma, from your own blood to help restore maybe the romance in your life. Holly Moody knows the value of this treatment. Today she's getting
a little bit of resurfacing. I like to have, it kind of helps with my pores. I have a scar on the side of my face that I'm trying to lighten, and that really helps with it.
PRP is made from the blood in your own body. It is placed into a machine called a centrifuge, which separates the PRP, or platelet-rich plasma, which essentially is its growth factor.
So then when we inject it back into your body, it stimulates the growth of new tissue.
But recently, Dr. Amy Brenner told me she shared with Holly that there's another off-label use for PRP. It is called the O shot.
This was definitely something that piqued my interest, that I wanted to hear more about.
The O shot uses the same process of separating the blood, but rather than placing the PRP on the face,
we inject it back into the female genitalia. We're using it in our practice for women that report vaginal dryness or painful intercourse.
Holly said she chose to have the O shot prior to this treatment because it was
kind of just getting to that point in my life where like maybe my hormones were starting to get a little crazy and out of whack, and what I could do to make myself feel better.
The O shot, which can be used in guys,
and that's called the P shot,
starts working in about 3 weeks.
PRP is like fertilizer for our bodies. So when we inject it into the female genitalia, it regenerates new tissues. So, so new collagen, new blood vessels, new nerves.
So pretty exciting stuff. Joining us now, Dr. Amy Brenner, a women's health specialist. Great to have you in-house.
Thanks for having me.
This is so interesting. I've been asked a lot of questions I'll share with you. And the first is, once you do this, then how long does it last?
So great question. There's actually ongoing research now, which is new for this space. But the answer is right now we don't know the answer to that question. We've been doing this in our practice for a couple years, and I've had patients want to repeat it as early as 6 months, and others who notice the benefit for as long as 3 years. I'd say on average, women are wanting to repeat it about once a year.
And well, it starts in 3 weeks. Do you have like, does it keep peaking, or how does that work?
Yeah, so we tell people it starts in 3 weeks and then the full effect at about 3 months.
Okay, so we have a little video to show you. One of the other questions I got asked is, it's off-label still means it's appropriate and not going to harm anyone, correct?
So there haven't been any significant side effects associated with the use of PRP really anywhere in the body. It was originally developed decades ago in the orthopedic space. And so, but as physicians, we use a lot of things that are off-label, and that means it's just not FDA approved. So
what was interesting about this was you said, yes, you know, we can use this to help with sexual function, we can use it in your skin, but then haven't you noticed, or haven't some people reported to you better luck with like pelvic floor related things and urinary things and whatnot? And like, how do you find out that it works for that?
So again, it was originally developed, as the name implies, O-shot, to make orgasms better. But then anecdotally, women were noticing it was helping with their leaky bladders. I assume the mechanism is because it regenerates collagen. And so it just supports that collagen in the area where surgically we would put a sling in.
And so it sort of helps regenerate the tissue, or just like the PRP would anywhere else?
Correct.
Yeah. You know, it's so interesting, and I appreciate you talking about these tough topics, because, you know, we always say that there's more adult diapers than there are, you know, baby diapers, and no one talks about that. No one talks about what happens as your hormones change and your intimacy changes. But one of the things I thought was so interesting is, while I was talking to you, you shared with me something. I said, you know, is this becoming more acceptable to talk about? And you said this. I want to get your reaction after you hear it.
I think that just society, with some recent movies over the last couple years and books, have made it not taboo to talk about it. So I know years ago when women would talk to me about sexual issues, I just didn't really have that much to say. I mean, the only thing I would say was, well, go on a date with your husband. And now it's really exciting because we actually do have some tools to offer to see if that can help somebody in the bedroom.
So the reason I love that is two things. It admits that this is always a science, and even you're always learning more.
Correct.
Yeah. And the other thing was, just the idea that if you have struggled with something for a long time and you go, oh, I tried all this stuff, I know there's nothing there, there might be something, right?
Right. So it is exciting in this day and age, being in sexual medicine, is that we are starting to have tools and options to give women, not just for orgasm or vaginal dryness, but even for libido. So now we do have options. So it's just something to bring up with.
Yeah, and I do feel like if we don't have people like you that are willing to talk about the tough subjects, we don't get, especially for women, them reimbursed the way they should. We don't get the research that we should. You know, a lot of these studies, like everybody's heard of the little blue pill, but we often don't hear about these options for women.
No, we still have a long way to go, but at least it's a start and there are some options.
Yeah, well, I feel lucky that you're a pioneer. Thanks for being bold and sharing this with us. We always want to share Dr. Brenner's number with you. If you have a question about something you heard today, please call her. It's 513-770-0787. Last thing, the cost for some of that PRP can go anywhere from a few hundred to about $1,000, or how does that work?
That's correct. Yeah. So the O shots, the first one is $1,200. It's less with subsequent treatments, but it is something right now that's not covered by insurance.
Yeah. Well, we're working on it. You know, we started out with a lot of these things that weren't. I hope maybe next year or the year after having this conversation, we're starting to see progress. So thanks for what you do in our community.
Thanks for having me.
Pleasure to share your work. Dr. Amy Brenner, Amy Brenner and Associates.